After 5 years of effort, 3 applications, 2 staff recommendations, 1 favorable Supreme Court decision, and thousands of support letters, the Commonwealth's Health Commissioner has awarded Chesapeake Regional Medical Center a Certificate of Public Need to have an open heart program. All the twists and turns, roadblocks, nuances make today all the more gratifying. What has been so inspiring from start to finish is the genuine and heartfelt passion, pride, and resolve from all concerned. It's this kindred and community spirit that defines us, sets us apart. Everyone in attendance has been part of our efforts, and I wish I could acknowledge each person present. Thank you, each and all, for your presence this morning. Elected officials have a unique role as public servants. All of the elected officials that represent Chesapeake provide letters of support. Those present today include Senator Lyman Spruill, Delegate Cliff Hayes, I believe, is here with us. Other members in the General Assembly wanted to be here, but could not. Mayor Rick West is here, Mayor. Dr. Ella Award, Debbie Ritter, Amanda Newens, Daniel Whitaker, and Jeff Bunn, all members of council. Thank you for your presence today. And I want to thank the media for your role, always capturing the most salient points of any story. All that you see happening at Chesapeake Regional, whether it's the Richard S. Bray Critical Care Tower, and Judge Bray is here today, the Priority Toyota Cancer Center, the Neuroscience Program, or any other such initiative. It's the result of a strategic operational plan. As it relates to the cardiac surgical program, demographics, clinical capability, and difficulties consumer experience all came part of our, I'll call it, came into play into our thought process. For Chesapeake Regional, we knew we had the clinical capabilities, and we set about building the needed operating room suite and inpatient areas. We also knew that our population is growing, Chesapeake being the second largest city in the Commonwealth, and the seniors that we serve in our particular region growing at a clip of 5% annually. Now, with approval on hand, we can move forward, innovate, and provide consumers with a healthy choice. With me today are several clinical leaders, Drs. Tom Carter, Joseph Sposato, and Ashish Bush, and our own board chair, Christy Wootman. Dr. Tom Carter, our medical director of cardiovascular services, will now make comment. Welcome, Tom.
Most of you realize that heart surgeons tend to be a little bit rogue. I've been doing in the OR for about 40 years, starting medical school. I was trained in the operating room, you wear a mask, and when you're out of the operating room, you get in trouble if you wear a mask. Yep. And it's always smart to follow the lead of your CEO. So. I want to thank you all for being here with us today to celebrate what we consider to be good news for our patients in our community. We serve a lot of patients who come to our hospital who have a need for heart surgery. And unfortunately, we've had to transfer them to outside institutions. Those institutions provide pretty quality care, but it's not as optimal for our patients because we believe that for good quality heart surgery care, you need your cardiologist and your heart surgeon involved. And you can't do that in a different institution. We're firm believers in a heart team model. We believe it so much that we spent money to build it ingrained into our facilities. our new ICU is going to have a separate carve-out space for post-op heart surgery patients. In a traditional institution, you go to the OR, have your heart surgery, and then go to the ICU. And then when you graduate from the ICU, you get to go to the step-down unit. And in some institutions, a third place, the floor. The problem with that is it slows down the recovery of the patient because treatment plans are based on what part of the building you're in, not what you need today. We're going to use a universal health model, universal bed model, which means the patients will come from the operating room to the intensive care and stay there, typically for the length of their stay. That means you're going to have the same team of heart surgeon, cardiologist, intensivist, nursing staff, clinical staff, care partners, therapists, care managers, all in one place, specialized in heart surgery, taking care of you every day. That means your recovery rate will be dependent on what you need, not where you are in the building. We've already been talking about, actually for the last few months, about how to integrate a cardiac care management team here in our hospital. We've presented it to the ICU and they're working on that staff. We're going to have the facilities and we're looking forward to that process because we think that's the best way to serve patients. We're also building a state-of-the-art hybrid operating room. The term hybrid is because it has not only the capability to do standard open heart surgery in a modern method way, but it also has state-of-the-art imaging in it so that you can do advanced cardiology procedures in the exact same room, and it turns out you can do it at the exact same time. This sets us up to be able to do TAVR, which is the abbreviation, acronym for transcatheter aortic valve replacement. It's done for patients who need a new aortic valve, but it gives us the capability of doing it without doing a sternotomy, without dividing the breast pump, without using the heart-lung machine. The recovery rate is a few days. We actually pass the aortic valve up through the groin and position in the chest. You need a special room to do that, and we're already building it and we'll be done soon. So I thank you again for participating here. I want to say that I've had experience establishing programs, building programs, enhancing programs, and improving the quality of programs for the last 30 years. And I am confident that we will have an outstanding patient care facility here for heart surgery for our patients in our community. So now it's my privilege to introduce the next member of the heart care team, Dr. Joseph Sposato, Director of Cardiology Services.
This is a wonderful time for us here in this community. In cardiology, we've been advancing cardiac care for several years here in this hospital. We've taken on more risk, we've taken on more responsibility in caring for patients. Patients have been able to have more advanced care here that doesn't involve transferring to other facilities. And that has been a collaborative effort among many of the cardiologists here and others who aren't here today. And that's been a great opportunity for us, but what we have is this hole in not being able to provide cardiac surgery. Patients who need cardiac surgery have to transfer out to other centers, oftentimes across the spectrum, either locally or up to Richmond or other cities, and so that puts an extra burden on the patient. There's a delay in care in that way. There's a delay in getting their heart surgery done, results in longer hospitalization. Family members have to travel further. We have patients who come from all over, especially coming up from North Carolina, Outer Banks, beyond that. Those family members look to come to the closest hospital and they want to stay here. The care here is outstanding, and so it gives us an opportunity to provide that level of care to patients who otherwise would have to go elsewhere. This idea of a collaborative effort, it has been many years in the workings. We have interventional cardiology. Dr. Butch will talk about some of the advances we have there. Having an open heart program allows us to do some more advanced things here. We have advanced heart failure capability, and so the whole spectrum of cardiology care gets to be lifted by the ability of providing heart surgery in this institution. I appreciate all the efforts that Reese and others have put into the physical plant. If you haven't been up to the ICUs, it's a beautiful, at least the parts that are open are just absolutely beautiful. And what's coming in the future with a central location for all cardiac care is really an innovative design, which I think sets us apart. And so we look forward to expanding on those capabilities here in this center. We look forward to working collaboratively, not only with physicians, but physician partners, with nursing, and all of the people that make open heart surgery possible. There is nothing more complex that's done to the human body than open heart surgery. There's no other surgery that's as complex as that. And so it's wonderful to be part of this vision, and I look forward to all that will happen in the future as we expand on our capabilities. I want to introduce Dr. Ashesh Butch, who's our interventional cardiology program director.
Thanks, Joe. So, before someone has cardiac surgery, you need to measure their heart arteries. You have to have what's called a heart cath. And you might end up having that by a number of routes. One, you may come in, the patient may come in with a heart attack. You find very severe blockages. The best way to treat it is heart surgery. You have to discuss and liaise with your cardiac surgeons to work out a treatment plan. And the other pathway is when someone is referred from the office. So the foundation for what we call interventional cardiology, where you treat cardiac conditions from tubes put in the wrist or the leg, is vital to develop a strong cardiac surgery program. And one of the things center stage for that is having a really good heart attack program. And Chesapeake Region has a stellar heart attack program. We have reliably rapid response times, and that's also reflected in excellent clinical outcomes. We have the best survival rates in the region. And that's also been formally recognized in terms of accreditation. We have a patent award from the American College of Cardiology for our Chesapeake treatment. I'll just segue a little bit to talk about something that's not entirely related to cardiac care. But just as you have heart attack, you have brain attack, stroke, and Doctors Baker and Cobb have done a brilliant job in developing a neurointervention program, and we have a Gold Plus Award from the American Heart Association for stroke care. And in fact, as you'll realize from what we're saying, every department is integral to building high-quality specialist care, whether it's infectious disease, cardiology, stroke care, so on and so forth. Over the last few years, we've upgraded and improved and treated more complex patients here at Chesapeake Regional, such that we don't have to refer many patients out for interventional procedures. That's the consequence of being able to treat patients with very calcified blockages, the ability to support sick patients by putting heart support devices in, and there's various other technologies that we are planning to introduce over the next couple of years in advance of having cardiac surgery go by. The most important thing I think that I do need to mention is the fact that what Dr. Carter, Dr. Spasato, and Mr. Jefferson have mentioned is collaborative care. I've worked in a whole variety of institutions both sides of the Atlantic. I've worked in teaching institutions and non-teaching institutions. And I think some of the things that excite me about Chesapeake Regional succeeding in its aim are several things. One, there is a particularly strong bond between the hospital and the community it serves, and that shouldn't be underestimated. And the second aspect is we have really good collegial relations. And we work well together, we work collaboratively together across disciplines. And I think those things really are things that deliver high quality care, because you can add great technologies, but it's actually people working together that develops high quality healthcare, and we have that here. So I think our foundation is extremely strong, and the future is extremely exciting. On that note, I'll hand back to Mr. Jackson.
So it's my proud honor now to introduce the anchor presenter. Dr. Christy Wooten is the Chesapeake Hospital Authority's board chair. And just to mention, all the board members, past and present, those in the future, and they really take their jobs quite seriously. They represent the community, they're great stewards of the community, and they're great ambassadors of the community. So, here today, Christy stands in everyone's stead. So Welcome, Christy.
Wow, the excitement in the room today is palpable. It's great to walk into this hallway to see all these familiar faces and to see some new faces joining us today for this very monumental time in the hospital's history. As the heart of this city, we recognize how impactful this cardiac program will be for our citizens in Chesapeake and in northeastern North Carolina. Chesapeake Regional has made significant investments in producing excellent outcomes and high-quality patient experience. For instance, we've made recent investments in the neurosciences, heard a little bit about that today, and we have been designated as a comprehensive stroke program. And our efforts have led to our 4-star ratings with the Centers for Medicare and Medicaid Services. It is with that very same level of enthusiasm that we now invest in this cardiac program. As we innovate for life, we are also building upon our deeply rooted legacy, a legacy born out of community and with a keen awareness of the needs of our citizens. And I want to take just a second to talk about legacy because somebody in this room reminded me of the importance of the legacy in this hospital that got us to today, and just a little bit of a full circle moment. Mr. Emmert, who's standing on the stairs behind you, is one of the attorneys who argued our case at the Supreme Court. And he reminded me that when he was a young man, he lived just about a mile down the road. And he sold t-shirts as part of the class project to help build this hospital. Full circle, many years later, he's standing with Mr. Millett before the Supreme Court arguing for this program. That is really the heart of this program, the heart of our community, the heart of our hospital. Listen to our needs of our patients and fulfill those needs. So it is with grateful heart, again, that I'm thankful to the leaders in the city of Chesapeake and to each of our community partners who support us in this journey. It is vital that we offer a healthy choice for our citizens. So I want to emphasize that this has been a team effort. Many of the team have been mentioned today already. I do want to include in the acknowledgement and give heartfelt appreciation to the attorneys who steadfastly argued our claims, to our current board members, our current hospital authority board members, Mr. Maxwell, Mr. Tall, Mrs. Gilmore, Mrs. Baines, Mr. Ennis, Mr. Davis are with us today. Thank you for supporting this endeavor. And for our past board members, some of whom are with us today, Ms. Matthews and Mr. Oman, it's nice to see this come to fruition. You had faith. It's nice to be here today to see the results of the actions that have taken and the decisions that have been made over many years. So again, heartfelt gratitude. Thank you for coming and joining us today. Now I return the mic back to our man in charge, Mr. Rex.
So it's really true that we are all one body. And at this time, if you have any questions of us, we're happy to answer any questions. And also, Amber Edgett, our Chief Operating Chief Nursing Officer, is available when we conclude this time period to take you on a tour. We'd love to show off our facilities. So, do you guys have any questions for me? Yes.
So, your press release talked about wanting to inject competition into the market. So, is Chesapeake Regional planning to offer lower prices for these surgeries, or how do you intend to?
Yes. So the question is about beneficial competition and the reference made to it in our press release. So when the commissioner issues his opinion, he makes reference to the 8 statutory considerations, one of which is beneficial competition. So that is something that the commissioner noted in his reason to give approval for our program, is that we would offer beneficial competition to our community. And we already do have the lowest prices. So that was something that we provided as part of our application. So, we're thrilled. We think there's enough room for us, and we intend to make the most of it. So thank you for your question. Are there another question? Sure.
Just briefly, how many procedures do you expect to be able to conduct the first year?
Yeah, so in the first year, we expect to perform 150 procedures, and in the second year, 250, and we'll see. at least 250 each and every year. Any other questions? You wait. Okay. All right. Okay. Well, I'm definitely available to answer any questions afterwards too. So a big sigh of relief. Take a big breath. Feel free to stay. We have some refreshments in the back corner over here. And again, we're just so happy that you've all supported us through thick and thin, and you'll continue to do so, and we'll continue to make history here. Thank you so much. Take care.